You are sitting in a hospital bed on a Tuesday afternoon in late October. The sheets are clean and white and smell faintly of industrial detergent. A nurse adjusted your pillow 20 minutes ago and asked if you needed anything. You said no. You said it carefully, deliberately, because speaking has started to feel like something that requires planning. Outside the window, a tree is losing its leaves in the wind. You watch them fall because watching them is something you can still do without it costing you very much. Your wife is sitting in the chair beside the bed. She has been sitting there for 6 hours. She is holding her phone, but not looking at it. She is looking at you instead. And you can see in her face something she is trying very hard not to show you right now. You know what it is. You have known for 11 days. You are going to die in this room. Not eventually, not someday in the abstract future that everyone carries around with them like background noise. Soon. The doctors have not given you a number of days because the honest answer is that they do not know exactly. But they have stopped talking about treatment options in the forward-looking way they spoke during the first 2 days. They speak differently now, carefully, with a particular gentleness that is its own kind of information. You were bitten by a bat 7 weeks ago. You barely noticed it at the time. First, understand what rabies actually is and why it is unlike almost anything else. Rabies is caused by a Lissa virus, a bullet-shaped RNA virus that has been infecting mammals for millions of years before humans existed. It is not a new pathogen improvising its way through your body. It is ancient, specialized, extraordinarily good at one specific thing, traveling from a wound site to your brain along the highways of your own nervous system. Most viruses enter the bloodstream and spread through the body that way, which is why your immune system can often intercept them in time. Rabies does not do this. It enters the nerve endings near the wound site and begins moving inward along the axons, the long fibers that carry signals between nerve cells. It moves slowly by viral standards, roughly 12 to 24 millimeters per day, depending on the nerve fiber it is traveling through. This is why the location of the bite matters so much in determining how long you have. A bite on the foot gives you more time than a bite on the shoulder. A bite on the face or neck gives you very little time at all. The virus is simply walking toward your brain along the most direct neural route available, and it will arrive when it arrives. While it travels, you feel nothing unusual. This is the feature of rabies that makes it so reliably fatal in unvaccinated people. The incubation period, the time between bite and first symptoms, is typically 1 to 3 months, though it can range from days to more than a year in rare cases. During this entire window, the virus is moving through your nervous system without triggering any immune response you would notice. You feel fine. You feel completely normal. You go to work, you eat dinner, you sleep, you make plans for next month. The immune system cannot see the virus during this phase because the virus is hiding inside nerve cells, which the immune system largely leaves alone to avoid damaging the nervous system itself. By the time symptoms appear, the virus has already reached the brain. By the time symptoms appear, post-exposure vaccination no longer works. The window for intervention has closed completely and permanently. Once inside the brain, the virus begins replicating rapidly and spreading through neural tissue. It targets the limbic system, the emotional and behavioral center, and the brainstem, which controls the most fundamental functions keeping you alive. It causes encephalitis, inflammation of the brain itself, swelling inside the skull, neurons misfiring and dying in cascading waves of damage. There is no approved treatment that can stop this process once it has begun. The fatality rate for symptomatic rabies is effectively 100%. In the entire recorded history of medicine, fewer than 20 people have survived symptomatic rabies infection. Most of those survivors were left with significant neurological damage. The virus has been killing mammals since before our species existed, and it remains almost perfectly lethal today. The prodromal phase, when your body begins sending signals you cannot interpret. The first symptoms of rabies are almost insultingly ordinary. Fever, headache, fatigue, a general feeling of being unwell that could be the beginning of any common illness you have had before. Many people assume they are getting a cold or the flu and wait for it to pass on its own without concern. But there is one early symptom that is specific enough to be diagnostically significant when it appears: pain, tingling, or itching at the site of the original bite. Weeks or months after the wound has completely healed over, the skin looks normal. There is no visible injury remaining, but the nerve endings in that area are beginning to register the virus's presence as it moves through them, sending confused signals upward toward the brain. This symptom is called paresthesia at the wound site, and it is the nervous system's first attempt to tell you that something is wrong, in a language you do not have the vocabulary to understand yet. Most people who experience it do not connect it to a bite that happened 2 months ago. Why would they? The wound healed. That was over. This is something new and unrelated, probably. Anxiety arrives during the prodromal phase, not as a response to knowing what is happening, but as a direct neurological symptom of the virus beginning to affect the brain. The limbic system is being disturbed. The emotional regulation centers are beginning to malfunction. You feel a formless dread that has no specific object, an unease that follows you from room to room without explanation. You sleep badly. You feel irritable in ways that seem disproportionate to anything actually happening in your life. This phase lasts 2 to 10 days. Then it ends and something else begins. The acute neurological phase, the brain under siege. This is where rabies diverges completely from ordinary illness and becomes something that has no real parallel in human medical experience. The virus has reached sufficient concentration in the brain to begin causing dramatic, visible neurological symptoms. What happens next depends on which form of the disease develops, and there are 2 distinct forms with different presentations. The more common form is called furious rabies, and it is responsible for the image most people carry of the disease. The less common form is called paralytic or dumb rabies, and it is quieter and in some ways more difficult to watch. In furious rabies, the brainstem is heavily affected early, and this produces the symptom that has defined the disease in human consciousness for thousands of years: hydrophobia. The word means fear of water, but that description is incomplete and slightly misleading about what is actually happening neurologically. The virus damages the neural circuits controlling swallowing and the muscles of the throat and respiratory system. When you try to swallow, water, saliva, anything, those muscles go into violent, painful spasm. The spasm is involuntary and agonizing and completely beyond your control. Your body is trying to swallow and simultaneously seizing against the act of swallowing, and the result is a convulsive, terrifying episode that lasts several seconds. After this happens once, the brain begins to associate the sight of water, or the sound of running water, or even a breeze on the face that mimics the sensation of drinking, with the incoming spasm. The anticipatory terror becomes conditioned and automatic. You become genuinely, viscerally, neurologically terrified of water. Not because you are irrational, because your brain has learned, correctly, that water means agony is coming. Aerophobia develops alongside hydrophobia through the same mechanism. A current of air on your face triggers the same spasm, the same terror, the same convulsive response. Doctors examining patients with furious rabies learn to move slowly and avoid creating air currents near the patient's face. A door opening across the room can trigger an episode. Between these episodes, something stranger happens. The virus is affecting the limbic system, the seat of emotion, aggression, and social behavior. Patients with furious rabies experience periods of extreme agitation, sometimes aggression, sometimes hypersexuality, sometimes a frantic, driven energy that has no outlet or direction. These episodes alternate with periods of relative calm and lucidity that are, in their own way, the most for everyone in the room. During the lucid periods, you know what is happening to you. You are fully present, fully yourself, fully aware of where you are and what the trajectory of this illness means. You can speak to your wife in the chair beside the bed. You can tell her things you need her to know. You can be, for a few hours, the person she married, rather than the person the virus is making you into. And then the agitation returns, and the spasms return, and the person you are recedes again behind the neurological storm. What the inside of it feels like, as best as anyone has been able to describe, survivors of near-fatal encephalitis from other causes, and the rare rabies survivors, and patients who have been able to communicate during lucid windows, describe the experience in ways that share certain features across different accounts. There is a quality of fragmentation, the sense that your thoughts are not staying together the way they normally do. that a sentence you began has lost its ending somewhere before you reached it. You reach for a word and find the space where it should be empty. You reach for a memory and find it present but somehow inaccessible, behind glass, visible but untouchable. There is pain that is difficult to localize because it seems to come from everywhere and nowhere simultaneously. The headache of encephalitis is not like ordinary headache. It is pressure from inside, the skull feeling too small for what is happening within it. Light becomes painful. Sound becomes painful. The ordinary sensory environment of a hospital room becomes a source of continuous, low-level suffering. There is fear that is not entirely psychological. The virus is directly stimulating the fear centers of the brain, producing terror as a neurological symptom independent of what you consciously know or believe. You can know, rationally, that you are in a hospital with people who care about you, and simultaneously feel a dread so profound it has no bottom. These two things exist at the same time without resolving each other. And there is, in the lucid periods, something that several accounts describe as a strange clarity. The things that seemed important before, the unfinished project at work, the argument from 3 weeks ago, the bill that needed paying, have simply ceased to register as significant. What remains is simpler and more essential. The face of the person sitting beside the bed, the quality of the light through the window, the fact of having been alive, which turns out to be a more remarkable thing than it seemed when it was guaranteed. The final phase, the brainstem, fails. As the virus continues its destruction through the brainstem and cerebellum, the systems that require no conscious effort begin to fail one by one. Breathing becomes irregular. The automatic rhythm that has run without your attention since before you were born begins to lose its timing. The heart rate becomes unstable. Blood pressure fluctuates in ways that the body cannot compensate for adequately. Coma arrives, and with it, a mercy that the earlier stages did not offer. The agitation stops. The spasms stop. The terror stops. The person in the bed is still breathing, still producing the biological signals of life, but the experience of being that person has ended or receded beyond any point of return. Death from rabies typically occurs within 2 to 10 days of the first neurological symptoms appearing. It comes from respiratory failure, cardiac arrhythmia, or the cascading failure of brainstem functions that can no longer sustain the basic operations of a living body. It is not peaceful in the way that some deaths are peaceful, but the final hours in coma are quiet in a way the preceding days were not. What you should understand if you were bitten by an animal and did not seek treatment post-exposure prophylaxis, the series of vaccines given after a potential rabies exposure, is extraordinarily effective when administered before symptoms begin. It works by giving the immune system enough time and information to find and destroy the virus before it reaches the brain. It is not painful in the way the old treatment was. It is a series of shots in the arm over 2 weeks, and it works. The window for this intervention is generous. Weeks, sometimes longer. But it closes permanently and completely the moment symptoms appear, and it cannot be reopened by any means currently available to medicine. The bat bite that started this story, the one that was barely noticed, the one that seemed too small to matter, is the most common source of rabies transmission in the United States today. Bat teeth are small enough that a bite can occur during sleep without waking the person. Wildlife officials recommend that anyone who wakes to find a bat in their room seek evaluation, even without a visible wound. The person in the hospital bed on the Tuesday afternoon in late October did not know this. They noticed a small mark on their hand one morning in September and assumed it was something else. They waited to see if it would develop into anything. It did not develop into anything for 7 weeks. And then it developed into everything. The tree outside the window is still losing its leaves. The wife in the chair has put her phone down entirely now. She is holding the hand on the bed, the hand with the small scar that has long since healed over. And she is not saying anything, because there is nothing left to say that has not already been said during the lucid hours. The lights in the room are steady. They do not flicker. Outside, the wind moves through the branches of the tree, and the last leaves fall, and the afternoon continues in the ordinary way that afternoons continue, indifferent and unhurried, while inside the room, something ancient and patient finishes the work it began 7 weeks ago, in a moment so small it went unnoticed entirely.